Good.
Great. Good afternoon, everybody. Welcome to our last Board of Health meeting for 2020. It's so nice to see all of you. We are recording this session today. It won't be streaming live on YouTube, but it will be available for anybody who would like to watch it tomorrow. So I think our first order of business for today is privilege of the floor. So Frank, and we have Frank Towner from the YMCA. Oh, there he is. Welcome. So Frank, the way that this works is we will provide you with 3 minutes to address the board, and then I'll open the floor for any questions that we may have. And then at that point, we do ask, we're going to have you leave the board meeting at that point. Frank Kruppa, I don't think there's a way to permit him to continue to watch just because we're not on YouTube right now. So he'll leave after we're done, right?
Yeah, that's fine.
Towner, please.
Thank you.
Yes, welcome.
Well, thank you. Appreciate the opportunity to present to you all. Basically, quick history. We got a 152-year-old institution called the YMCA of Ithaca and Tompkins County that has struggled since our closing on March 15th. By the numbers, we had 3,540 members. Today we have 1,618. We had 137 staff. Today we have 27. We were closed basically until August 31st. After opening, we are bringing in about, the maximum was 187 people a day on average. It's about 120. Not sustainable. We are not creating income. Bottom line is that we need 320 people by our estimate. What our usual daily activity was, providing swim lessons and after school care and family programming and senior programming to really pay the bills. So it was my request of y'all if we could waive the fee for our pools this year. The small pool is not being used at all, as the cost to have a third lifeguard on is not financially feasible for the programs that we are unable to offer. So the large pool is servicing, as you know, 1 swimmer per lane for health relations, and appreciate all you've done and commend you for your diligence in making all this happen. I know it's not easy for any of us, but what you are doing, and our contact, Mikhail, has been awesome to work with, and Frank, of course, and Dominic I've known since he got out of college. So we're all in this together to make that happen. So my request would be that we would waive those fees based on our financial challenge, limited use of our pools. And if you could see your way clear to do that, that would be a really nice gift.
Great, thank you, Frank. Any questions or comments from board members? Shawna.
Frank, can you tell us how much those fees are?
Yeah, without looking, I didn't pull up. It's $375.
Or does anyone know?
It's like $375 a pool.
Okay.
So it's 700 and some change.
It's sorry, Liz. It's $670. It's in the, is that right, Liz? Did I quote the right number? It's at the end of the board packet.
Okay.
Any other questions?
Okay, well, thank you.
Great, thanks so much, Frank, for coming, for your
Thank
time.
you. Hawaii is a safe place to come, so y'all come visit, won't you? All right, have a great day. Appreciate it.
Thanks, Frank. Bye.
Thank you.
Sorry, muted myself. Next item on the agenda is, hold on, I got to go back up to my agenda, is the approval of the October minutes. So could I get a motion to approve as written? I have a first from Sue and a second from Shawna. Any discussion? Okay, everyone in favor? Anyone opposed? And any abstentions? Okay. Moving on to, is Brenda back yet? She's not. Okay.
No,
Are you
she's not.
handling hers?
Yes, very badly. There is a report in the packet, I believe. Don't have a lot to add other than we're doing year-end work now. Karen Johnson has been crunching through all the numbers and things. It's going to be a crazy year, and I don't know that anything we would tell you today is how things are going to wind up when it's all said and done, because there's been monies coming in from state grants, and there's been monies going out for things that we never planned for, and we're not doing some services that we had, and so it's really going to be a wonky year for staff to figure out. But they're on top of it, keeping track of it all, and certainly the county administrator is also aware of the situation, and we're working directly with them for any of our resource needs.
Okay, Frank, thanks. I just want to let you know is that I don't think that the financial summary is in the packet. Unless it's just was in an odd place and I missed it. I just don't remember seeing it.
Okay.
Yeah, I did not see it either. Yep.
Okay.
All right. Well, so one of the things that we've been struggling with is the Board of Health packet, because everyone obviously is extremely busy right now. I'll get something from Karen Johnson and have it emailed out to all of you.
Okay, that'd be great. Thank you.
Yep.
Okay, any questions for Frank about the financial summary or financial issues? Okay. And if so, Frank, can you keep going with administrative report?
Yep. And first thing I want to do is introduce Claire Espey. Claire is our new Director of Community Health. She started on November 30th. And she comes to us with large amounts of international public health experience. So I'll probably let Claire introduce herself to the group real quick, if you don't mind, Claire.
Sure. Oh, I never know where to look. Hi, I'm Claire. I'm happy to be here. It's aligned with some of my experience in public health, maternal child health, community health, and I've had the experience of living through 2 multi-layered pandemics and kind of ongoing crises, particularly in the Eastern DRC with Ebola and then COVID. So I'm hoping to learn from you all. I'm really impressed with the systems in place for the COVID contact tracing and investigations of cases, and look forward to kind of supporting and looking ahead to the vaccine rollout, finding ways to build the system back better after this pandemic. So Karen Bishop had, big shoes to fill. So I'll do my very best and know that I can rely on the support of an excellent team at Community Health. So thanks, Frank. Happy to be here.
Great, welcome. And so Claire has been going through a rather unique onboarding process, as you can imagine. So we're trying to get her settled in, and she's getting up to speed with our COVID activities to be able to support and lead the team there. So we'll do our best to be gentle. She keeps coming back, so that's a good sign so far. And we're very happy to have her on board, and excited about the future.
Well, Claire, I just want to say welcome to you as well, and thank you for taking the position. And we, really look forward to working with you and helping to support however we can. We know this is a really challenging time for the health department. So you do have big shoes to fill, and there is also a raging pandemic at the same time. So anything that we can do to help support you, please make sure to let us know.
Great. And then I guess the other bit of news is this is Janet Morgan's last Board of Health meeting with us. After a long and distinguished career on the board, her term is ending. So we do have a certificate that we've put together for her. Shelley has it. She's going to hold it up because I forgot where I was going to be. So Janet, we've got that for you, and we'll make sure we get it delivered to you. But I wanted to take a chance to thank you for all of your years of service on the board. Your insight and support has been invaluable through all of the ups and downs that we've been through. And you know, every time somebody leaves the board, it's just always a bit inspiring to see that they've dedicated so many years volunteering to help us do the work that we do. So thank you, Janet. We really do appreciate it, and you know, we wish you the best of luck.
I'm going to give you actual claps you can hear, Janet. Thank you so much for everything that you've done. And I've had the pleasure of serving with Janet, not just on this board, but several of the subcommittees or spinoffs of this board for various things that we have done. And just want to reiterate and agree with everything that Frank said. She has been wonderful to work with and have really appreciated all of her insight and collegiality and working together on some of these really important issues. So what are your next steps, Janet? Anything fun? Are you volunteering for Governor Cuomo's healthcare workforce?
Gee, that hadn't occurred to me. On Friday, November 13th, our furnace died, and we've been without central heating since then. We chose not to replace the parts that needed replacing because we were waiting to have a heat pump system put in, which is finally now going in, and maybe by the end of this week we will have heat. Fortunately, we have a really good wood stove that heats part of the house. So that's been my immediate activities, along with grant writing for a couple of organizations. I certainly look forward to being able to get together with my grandsons and other family members and travel like the rest of you do. So,
well, congratulations.
Thanks.
Thanks, Janet. We're not going to let you get too far. We need some help with the Burmese population and communicating with them. So
Okay.
I think we're going to be reaching out.
Okay, good.
Thanks. All right. So moving along, COVID update. Yesterday was a record day. I'm guessing everyone has seen we had 61 cases yesterday. I can't say enough about the staff and what they've been doing. All of those people were called and put into isolation yesterday by the nurses. So almost double our highest day came in, and they still managed to get through all of that. So they are amazing. We also have a cadre of helpers from all over the county, the different departments. I think there's roughly 50 of them now in the pool of people that are helping, and they're working to grow that even more to help with contact tracing and the sorts. So we would not have gotten through yesterday without their help, and they continue to help as well. So that's the good news. We've got an awesome team, and they're doing an amazing job under very difficult times. I guess the not so good news is we had 61 cases yesterday, and you know what that means. There's a lot of it is related to small gatherings within homes, and then we're finding entire families testing positive, and that's really driving the numbers. Obviously, we're seeing the impact of Thanksgiving right now. We had a record day yesterday. Cortland had 50 cases. Steuben County had 123 cases. You know, all records for counties in this region, and so there's absolutely things heading in the wrong direction, and there's certainly an impact from the holidays being felt. So we put out a public information yesterday, a press release. We're doing another town hall tomorrow to try to get the message out as the holidays continue about folks limiting those gatherings to try to slow things down a bit. But we do expect we're going to see this continue at least for a little while. I guess on the other front is vaccination, and good news coming from there. We could have vaccines going into people next week. The state is telling us that they think perhaps December 15th we would see vaccination starting to occur. The first priority populations are going to be healthcare workers and long-term care facilities. We've been partnering with the hospital. They're prepared to support vaccinating their folks and helping us vaccinate other healthcare workers in the community at large. And the federal government is contracting with private pharmacies to help with the long-term care facilities. So we met with the long-term care facilities, what's today, Tuesday, so late last week, and they were already being contacted by their pharmacy vendors about planning for coming in and giving vaccine to their staff and residents. So that's starting to happen and unfold, which is good news. We continue to plan with Cayuga Health Systems about broader vaccination. We do have our medical countermeasures plan that we'll be activating, and we're putting some details to it now as we learn more information about the vaccine. These initial vaccines will require 2 doses. So a first dose and then a second dose 21 days later. You're not considered fully vaccinated until you have that second dose. And then really 7 to 10 days after that, after the vaccine has a chance, your body has a chance to respond to the vaccine. So we're gonna have a lot of work to do getting the message out first, getting people to get vaccinated, and then 2, making sure that they get that second vaccine to fully finish the series. So a lot of work continues. As we see the cases rising, we're preparing for that, as well as hopefully administering the vaccine that can bring all of this to a conclusion for us sometime next year, hopefully. So I think that's the general. I'm happy to answer any questions anyone has.
Sue.
Frank, I was listening to Governor Cuomo and trying to understand what triggers next steps. And it seems like the state now is only looking at hospitalization rates, not number of cases. Is that your understanding?
No, I think they've just added the hospitalizations to what they're looking at. There's a lot of questions about, with the cases rising so much, about shutdown, right? When is shutdown coming? And I think yesterday he tried to outline, I guess it was yesterday, he tried to outline what the criteria would be for going immediately to red and shut down. And it's mostly around hospitalizations. I think you'll still see yellow and orange zones happening around cases and the such, but he's added new criteria to address that shutdown question.
Other questions for Frank? And then Sam has put into the chat the link for tomorrow's COVID-19 town hall, if anyone would like to attend that. Okay, Frank, anything else from you, or is that?
That's all I had.
That's all you have. Okay, great. All right, let's go on to Sam and health promotion.
Thank you. Hi, everyone. So we've had, I have a small staff in health promotion, but we've lost 2 of our staff over the past few months. They've retired. So Susan Dunlap retired most recently, who was a community health nurse. So I just wanted to publicly thank her for all of her years of service. And then otherwise, I just wanted to expand a little that obviously COVID is still taking up most of my time and the priority for health promotion, but we are continuously trying to move ahead the community health improvement plan and revisiting that. And so just this week, we actually started piloting like a process to review the interventions that were submitted in the community health improvement plan last December. And we have some really great partners in the community who are working with us on the steering committee and also able to help pilot this process that we want to go through to look at, how COVID has impacted these interventions, and also understanding, the existing structural barriers that are affecting those programs or services being implemented. So I'm hopeful that we can keep that process going, but certainly leaning on some community partners who can move it along. So, and Christina is serving on that steering committee as well. So that's it for right now.
Great, thanks, Sam. Any questions for Sam? Okay. Dr. Klepack, Medical Director's report.
Good afternoon. Good afternoon. Christina, I just wondered if Claire is familiar with the sort of where the various board members come from. It might help her to get oriented if every member had a chance to say sort of what constituency they represent or a little bit about their background.
Let's come back to that after we get through all these reports, and before we get into new business, Claire will do that for you. Okay, go ahead.
So I have just some numbers to correct with regard to Cornell students that are currently in our area. An updated report I got from Cornell indicated that at this point, on-campus students are 269 approximately, and off-campus students are about 7,826. I presume those are undergraduates. And then when you get into the next term, the winter term, the number on campus drops to 56. And Cornell is continuing to do their daily monitoring of students and also their ongoing twice weekly surveillance testing of undergraduates. So that's just a little correction to the report I gave you. I gave you quite a bit in my report. Maybe I should see if any of you have questions.
I didn't have a question. Maybe it's just more of a comment to just confirm across the board. Was the statement in there about the New York State Travel Advisory, and that for people who have tested positive already somewhere else, that we are not holding people to the travel advisory if they are within 90 days of having tested positive? That I interpreted that correctly.
Oh, yeah, that's correct, because
Okay.
There seems to be little point in retesting them.
Right.
Yeah, so we aren't requiring them to be retested.
Okay. Do they need to fill out the traveler's health form still, or they just don't do anything?
Frank, do you know the answer to that one?
I don't. It never hurts to fill out the form and put on there that they were previously positive,
Okay.
because New York State is really monitoring the travel. We're doing little with it. It's really all centered through that travel form, and then they're monitoring from there. I think what we've been saying locally is if somebody calls us, exactly what Dr. Klepack said, there's no need to get retested, but I don't want to tell someone not to do the travel form and New York State say something different. So
Okay.
it's probably a good idea that they fill out the form and just say they were previously positive.
Okay.
That brings up an important point, Christina, that board members, whenever they're talking to people in the public, we're finding that, unfortunately, as we might have predicted, this one exception to traveling and then being able to test out of the full 14 days of quarantine, this one exception is confusing people. And that's generally in quarantine, there's no way to test out of it. You're stuck
Right.
there for 14 days. But the general public is likely to get confused about this one exception. So whenever you're talking to people, if there seems to be something you can clarify for them, do so.
Okay. Great. Thank you. Any other questions for Dr. Klepack? Okay,
Bill?
great.
Just
Yep, sorry, go ahead.
yeah. I had posed a question to New York State Department of Health a couple of months ago regarding what to do with this group of people who have had illness and tested positive, and they become sick again within a 90-day time frame. What does one do about testing?
Yeah, I've addressed that in terms of thinking through the process, and I have shared it in a couple of different ways. It's currently a topic in the K through 12 public school system because they're faced with now kids who have previously tested positive. What do they do if they get some symptoms? Basically, the bottom line is that if it's within 90 days of them initially testing positive, that it's extremely rare to be reinfected. Not impossible, there have been documented cases. The documented cases have been ones in which they had sample from the first test, and they also had sample from a subsequent test. And they were able to genetically profile both of those samples and identify that they were different. You know, there's a little bit of spontaneous mutation that goes on with the genome for this virus. And they were able to document that they were different viruses, but still COVID-19. So that happens, but it's pretty rare. So the guidance is use your clinical judgment, try to make a positive diagnosis of some other condition. If you can't do that, and you think it still could be COVID reinfection, the advice is to get an infectious disease consult. Consider whether retesting is advisable. It may well be, but it sort of rises to, you really should be talking to an infectious disease person at that point before you actually absolutely decide this is a reinfection. If they are reinfected, then the question becomes, do they need to quarantine and isolate? I'm trying to remember what I read about it in the past.
It's changing every few weeks. So
yeah, you know, if it's a bona fide reinfection, I think we'd have to get guidance on that.
Yeah,
whether they need to positively stay in isolation.
That would make sense.
So,
thank you, Bill. I appreciate it.
Yeah, it's a thorny question. I'll try to send you my full diatribe on that in an email.
Okay.
Great. Thank you. Any other questions, comments? Okay. You ready, Claire? You're up. Welcome. Before you get started, why don't we, since you're about to talk to us, why don't we actually take a break now and tell you who we are so that you know who you're talking to, okay? I should have done that earlier, so apologize. Shawna, go ahead.
Can we get the food now?
What?
We get the food now from our normal. We usually have food set up on a table somewhere. So
Frank said, just wait, just listen for the knock at your door. It's about to be delivered by his elves. Shawna, can we start with you to do a quick introduction for Clara before she gives her report?
Sure. Hi, Claire. I'm Shawna Black. I'm a legislator and chair of the Health and Human Services Committee. Happy to have you.
Thanks, Shawna. Janet. Yeah. Oh, we can't hear you. You're muted.
Okay, I'm Jan Morgan. I'm about to disappear from this group. But I have been on the board for, I guess, 2 terms, which is probably 12 years. And now I'm on to other things.
Great. And Ed.
Hi, I'm a physician at Cornell Health and assistant medical director there as well. And I've had an interest in public health for a long time with training in public health and preventive medicine and internal medicine. So I enjoy working on this board and hearing everything that happens in our community except for COVID. Welcome.
Thanks.
It's really nice to have you here.
Thank you. And Sue.
Hi, Claire. Name is Sue Merkel. I teach at Cornell. My background's microbiology, and most recently have been teaching the public health microbiology course at Cornell, and have been on the board, I don't know, maybe 5-ish years, something like that, as a, I think I'm an at-large or Ithaca, anyway, community member.
And hi, Claire, I'm Christina Moylan. I work at Ithaca College and have a background in public health. And I think this is my 3rd or 4th year on the board. So welcome.
Can we introduce Jonathan too? She's heard about
Sure.
you, Jonathan, all the good things we say about you. But
Hi, Claire. I'm Jonathan Wood. I'm the county attorney, and not on the Board of Health, but I represent the Board of Health and the Health Department. I've been the county attorney, I think 28 years or something like that, but a long time.
Okay.
Thanks everyone for introductions. Should I just go ahead? So I don't have anything to report today. I am excited to learn more about the Board of Health kind of processes and systems. This is, for me, the first time I'm working in a local health department. I've worked in the past from the civil society kind of angle and within nonprofits. So really pleased to be joining you and look forward to working together.
Thanks, Claire. Okay, any questions or comments for Claire? Okay, great. We'll move on to Deb.
Hi, everyone. My unit continues to provide a lot of support for COVID, both support staff and nurses. That's tying up most of our time. Other than that, everything else should be in my report.
Okay, great, thanks, Deb. Any questions about children with special health care needs? Okay, and then Jonathan, anything from you?
Just briefly, I've been working with Frank and the health department on trying to increase the number of contact tracers we have beyond the normal health department staff and the issues which have come up with that. But other than that, no report.
Great. Any questions for Jonathan? Okay, and then Liz for environmental health.
I don't have anything to report. I have one question on the travel advisory where we're telling people not to get tested if they were positive within 90 days. Is New York State on board with that, or is that just a local interpretation? I'm just wondering whether New York State would make them do the full 14 days if they didn't do the test out option.
Yeah, my request to New York State on this issue is that their guidance is silent to it. So take that for what it's worth. We're trying to give people the best direction we can, but I always encourage them to fill out the travel form and consult with New York State if they have particular questions.
Okay, I don't have anything else to report.
Okay. Any questions for Liz on her report? Okay, and then did you go to Community Services Board, or did somebody go to that, or
Yeah,
their meeting?
I
Okay.
do go to all of them. Yep. Their meeting was yesterday.
Okay.
So your meeting is off schedule because you do this joint November-December one. Much of their agenda was similar to yours. We talked about the strategic plan, and then we had an executive session with several issues related to personnel that had to be addressed. So that was the bulk of their agenda last night.
Okay, great. Any questions for Frank about that? Alrighty, so let's move into new business then. We do have a little bit of administrative business to take care of as part of this. So I think first I wanted to turn the first part over to Shawna. Shawna, Melissa, I was like, I can't remember. Shawna, Melissa, and I did do interviews for the soon to be vacant Board of Health position. And we do have a recommendation for the board. So Shawna, if you could kind of take it from there, and then we can vote or see what we need to do next.
Sure. So we had 5 applicants for the opening, and we decided to reach out to 3 of them for an interview and to meet with Christina and Melissa and myself. And 2 of those were able to meet with us. The third decided she could not make the time commitment at this point. And between the 2, they were actually, they had different backgrounds. The first one was an employee at Planned Parenthood and really was involved in the community. She had recently graduated locally and was going to grad school. and she was actually a very good candidate. And then we interviewed the second person, who is a nurse practitioner at Reach Medical, and we actually really liked the fact that she had also worked at the hospital. She's worked in the nursing homes, and she really has a wide array of experience in our community. So she knows the players here, and we also think that she's going to be planted here for a while. Our recommendation is Samara Tochton, who again is a nurse practitioner at Reach Medical.
Okay, great. And so Frank, if I'm understanding process correctly, the board can choose to vote right now, or if we want further discussion, we'll have to go into executive session.
Correct.
Correct. Okay. So let me actually ask that in a reverse order, which is there anyone who would like to request that this goes into executive session for further discussion? Okay. So all in favor of the nominee as stated? Aye. Okay, anyone opposed?
Christina, I don't think you got a motion to that. I'm
Oh,
assuming.
I thought you said I didn't need a motion. It was just a straight up or down vote.
No, I'm sorry. You need a motion with a straight
Okay.
up or down vote.
I'll
Sorry.
make the motion.
Okay, Shawna, I've got a first from Shawna,
Second.
a second from Sue, but I don't permit discussion.
Correct.
Okay, and then, okay, all in favor? All opposed? And abstentions? Okay. All right, great. Thank you so much for doing that, Shawna.
Thank you.
Christina, can I make a comment?
Sure.
I am happy to be replaced, knowing that there will be another nursing voice on the board.
Thank you. So number 2, Frank, I actually realized I don't know what this is.
I gotta go back. And
I didn't look at it that carefully. I think I was thinking something else, and now I'm realizing I'm not sure I understand what this is. Is this for all of our officers?
It's, yeah, so president and vice president, or yeah, I think, and president and vice president. So generally what happens here is I've had a conversation ahead of time to find out if folks are interested in continuing. And unfortunately, I have not done that. What generally happens is the president hands the gavel over to me, and then I ask for nominations from the floor for a president. So we can do that if you'd like to. Yep. Okay. So then I will open the floor for nominations for president for 2021 for the Board of Health.
Can we renominate Christina?
You can nominate anyone you want.
All right, I'm going to do that then.
Nominate Christina as well.
All right. Are there any other nominations?
Do you want to do it, Christina?
Don't ask.
Yes, I would be more than happy to do that for everybody, for the board.
Thank you.
But I'm also happy to have some competitors if there's other people who would like to take it on. Okay.
All right. Are there any other
Yeah,
nominations?
Frank.
All right. Seeing none, we'll close nominations, and I will bring it to, actually, I guess I need a motion then to accept the nomination of Christina Moylan as president for 2021. Dr. Koppel, is there a second? Janet, and with that, is there any discussion? Seeing none, all in favor?
Can I vote on myself?
Yes, Jonathan says yes.
I can. I'm just making sure because we don't have a quorum if I'm not. Okay.
Yeah.
I have to
Right.
vote.
Anyone opposed or abstentions? No, that's unanimous. Congratulations, Christina.
Thank you.
Gavel is yours.
Okay, and so for the vice president position, are we able to vote on somebody who's not here and that we haven't spoken with in advance?
You certainly can.
Okay, so I would do the same thing, open the floor for nominations for the vice president.
Yes, same thing.
Yeah. So I'm opening the floor.
Are we nominating that little kid in the video?
Yeah. I saw Melly's phone. I assumed that was Dr. Dundali, so it is.
Are we nominating Melissa?
We can nominate whoever we want.
Who was it before?
Dr.
It's Dr. Evelyn.
Oh, we can nominate him again. He doesn't mind. I nominate Dr. Evelyn again, unless Melissa is interested now this time. So.
I just got on, but my guess is I'm going to nominate Evelyn too. So what are we nominating for?
Vice President.
Oh.
Of the board.
Evelyn.
Yeah, okay.
Okay. Any other nominations? Okay, so now I need a motion for Dr. Evelyn as Vice President.
I move.
First from Shawna, second from Sue. Any discussion? All in favor?
No.
Okay. All in favor? Anyone opposed? And abstentions? Okay.
No.
Okay. All right, so that's all we have to do on that, right, Frank?
Yep, we are all set.
So the next thing, just for folks to have a discussion, is our strategic plan update. And just because I'm getting my committees confused, I'm on that committee. Who else is on that committee? Jan, you're on that, or Sue's on that committee, and Jan's on that committee, right? And is there anyone else? And then Sam also comes to those meetings. And I'm not forgetting anybody, am I? Okay, so I'm gonna just start and have this just to bring folks up to speed, but if Sue and Jan and Sam, if you can please jump in if there's anything that I forget, or if I say this incorrectly, mainly because the COVID has really kind of upset the process, I think, that we had put into place for this. And so I myself find myself a little bit confused at times exactly where we are, because we've had to stop and start along the way because of COVID, and we actually have now delayed again beyond December and aren't meeting again. I don't think until, is it January, Sam, that the next meeting is? I can't remember, February, somewhere in there. So the current drafts were included in the, it's not in the board packet, but it was in the attachment to the email that went out about the board meeting. And there were two, actually, you know what? I think it wasn't in the actual board meeting. It went out on December 3rd from Karen. There was a strategic plan overview draft, as well as our strategic planning and staff development documents. So just want to make sure folks have those and have them in front of you, or if I need to re-forward them, I can do that quickly here if we need to. Okay, so there's two pieces to this. I am going to start with the strategic plan overview draft to give folks a sense of what this is looking like. So as a reminder, this is about the integration of the public health department and the mental health department into one cohesive structure or integrated structure. And so the process for this is, there's kind of two parts to the process. One is a staff-based committee that includes representation from both of those departments, as well as a board level committee that includes representations from both of those departments, who are somewhat working back and forth on the details of what we think what this should look like. And so the three main things we've talked about in our last couple of meetings, one has to do with the mission and vision, which I think are the two biggest pieces. And then further defining that into the intent. And then the third piece, thinking about what we mean when we talk about our values-based culture. So that's the first document that you have. And I just want to stop there for a second and see if Sue or Sam or Jan have anything specifically about this document that you think we should kind of highlight for board members.
I think the only thing I would add is that it's still very much a work in progress, and we talked about at what point we should share with both boards and decided it was important to do it sooner rather than later. So if people read through this and at any time have questions, comments, or concerns, it's definitely not set in stone yet.
Yeah, and currently the different committees are working on breaking out or fleshing out these priorities more. And so that will sort of be the next version that we'll bring to you.
And that is kind of the process that we've been using up to this point, is this iterative process of having discussions and kind of going back to the drawing board. And I think to Sue's point, we had just, because there's been so many interruptions, we wanted to make sure that we had gotten something back to the board before the end of the year. So you kind of saw where we were with things, because we are just a bit off schedule, that it's still a work in process. And so the second document that you have is a summary of kind of what's been done to date, just to remind you of where we started with this and where we are now. But I think more importantly is what is about to happen in 2021. Like I said, because we've had to push some of that into that next year, that we do have advisory committee as well as planning committee meetings coming up, and that we would be coming back to the board again with additional feedback and information about how that's progressing. So I do think the important thing right now is that if you didn't have a chance to look at this before, that you do take a look at the document that's called Strategic Plan Overview. And if you have any comments or concerns or questions, because that is the framework that's laying the groundwork for how these two departments will function in the future. So if we've got concerns with wording or concerns with how it's structured or any of that, now is the time for us to speak up and make sure that that's clear. Okay. So Sue or Jan or Sam, anything else that we want to add to that? Or is there any other discussion that folks want to have about this right now? Okay.
And I would just say, if there's any additional input, if people do review it after this meeting, that they're welcome to email any, questions or edits to me, or we can share the consultant's email as well.
Yeah. Okay, because that will become our guidepost for implementation and how we do business. So we do want to make sure we have it right before we roll it out. All right. Okay. Let's go. If there's nothing else on that, then I'm going to go ahead and move into the environmental health actions. So we do have an administrative action here. This is the YMCA request to waive the swimming pool permit fees. Frank Towner came and spoke with us earlier today about this. So can I go ahead and put this under a motion right away, Frank, or do I have to do something different? It's the same process, right, for this?
Yeah, same process.
Okay. And so is there a motion to accept the recommendation as written? First from Sue, a second from Jan. Any discussion on this? Yes, Shawna.
I was just hoping that as the other pools come along to get their certification, if we could also mention that this is something that they can do is apply for a waiver, because I know that the city of Ithaca has Cass Park, Horizons had low enrollment, Ithaca Swim Club also had half of their capacity. And I think all of these pools are having a hard time getting membership and keeping afloat. So if we could mention that this is an option to the others, I think that would be helpful.
So I'll have to check, but a lot of the swimming pool permits have already been submitted. And the YMCA was the only one that did request a waiver from their fee. So I can get back to you at the next meeting, but they may have already paid the fees for the pools that you mentioned.
Okay. Do most pools know that that is an option to have a waiver?
We don't normally grant waivers from the fees. We did grant, we granted delays, I think, in the permit fees for like restaurants and stuff this year. But we haven't waived, in general, we have not waived fees for operating businesses. You know, that is the process, but it's not something that we advertise. If somebody asks about their fee, then we tell them this is the process.
Is this something that is done for nonprofit organizations, or are we making any specific value judgment based on this decision across the board, or?
The Environmental Health Division is presenting this as a facility-specific request.
Okay.
So Ed, maybe to your point, maybe the question for us as a board is if we are going to grant this request, in case other requests come in, are there principles or guidelines that we would use to draw lines around what we would grant and what we would not? Or is it just that anybody who comes and asks for a waiver of permit fees related to pools is going to be granted?
That would be my concern, right? Thanks for speaking to that.
I mean, I think part of the issue is that this is just such a crazy time. I mean, I might, under other conditions, say, oh, maybe we can differentiate between profit and nonprofit, but even the profits aren't profiting. And so everybody is just hurting so much. I guess the balance is that if we waive fees and support businesses, then we're not supporting the income that could be used towards Board of Health issues. And, you know, that's not an easy balance.
So Liz, are you able to speak to that? If we waive fees for this, what are we impacting? What are those fees supporting?
So the fees for all of our fees support our environmental health actions. That includes the permit review and administration process and the any outreach we do, responding to complaints and conducting the required inspections. And I'm not specifically remembering, you know, overall our fees cover 20% of our costs for all of the fees that are collected for public water supplies, sewage systems, restaurants, hotels, everything that we have permits for. I'm not immediately recalling what that percentage is for pools, like how much of our income we're recovering, right, or how much of our expenses we're recovering through our fees for the pool program.
So the point but the general takeaway is that those fees, similar to other fees, are offsetting costs related to the work and the business of the health department for inspections and approvals and paperwork, et cetera, et cetera.
Yeah, definitely. Yeah, we do not make a profit on any of our fees.
Right.
We only cover a small percentage of the cost of our efforts.
Right. Okay.
And I think you could make an argument that all of our facilities could make an argument about their ability to pay, right? Because of how things are. I think we have to be careful unless the board is making a policy decision that we're not collecting fees this year. We should probably just allow people to ask when they feel like they need to ask and address them on a case-by-case basis. Because otherwise, I don't know how you would differentiate across all of the different facilities that are struggling right now with financial issues.
I do have a question about why they need an application fee for the small pool when that's not functioning now.
That if they want to open it later, they're paying for it now. Well, they're doing everything they need. So we will be issuing the permit, and then when they open it, we would do like a pre-operational inspection of it. But so this just gets it all set up so they can open it whenever they are able to. They won't have anything from us stopping it other than if they need an inspection to be arranged.
And are these fees done on the calendar year, or is it a year from when they apply?
The permit is valid for a year. The fees for, I think, indoor pools are generally now, but I'd have to check. So each permit is good for a year. When that permit period starts depends on what the operation is. I think most of our pools are starting now. If they're indoor pools, outdoor pools, you know, it varies in different programs. But so it does cover a year period from whenever their permit is issued, unless it's issued late. If that made sense.
Because one idea would be to waive the main pool fee and to have them deal with the small pool later.
Then they would either have to pay the fee or we would not be issuing the permit now. And then we would need to issue the permit. We would need to go through that review process later. It complicates some things administratively for us to have to track, you know, that one specific pool is not opening right now. So we can do it, but it's probably a minor complication to do that.
But it looks like Environmental Health Division, you said, supported the waiver.
However, I think we have already issued the, no, I think we must have held the permits. Yeah, I don't think I've issued those permits yet.
Other discussion? Are we ready to vote? Okay, so Melissa, we're gonna need you to come off mute to vote so that we can see you or hear you. So,
and I will say neither of those permits has been issued yet pending this action.
okay, so any more discussion? All right, so all in favor as written, which is the recommendation to waive the operating fees for 2021 for YMCA. All in favor, aye. Melissa? Okay, all opposed? And abstentions? Melissa?
We can record Melissa's vote after. We'll check.
Okay. Okay. All right. Thank you, Frank.
Oh,
Let me go. What? Are you a yes? I can't hear you, Melissa. Yes. Yeah. Okay. Okay. Our next action relates to the apartment complex. And so do we want to start with a motion on this as written? I've got a first from Ed, a second from Jan. So let's go ahead and open for discussion. Liz,
do you want me to give an overview?
Brief? Yeah.
So you've had TOSA apartments in front of you several times now. A brief summary, right? They're a small apartment complex that are regulated as a public water supply. They've been on a boil water order since I can't remember, June, something like that. It's been quite a while. And they were experiencing a lot of water outages, not having enough water for the apartment complex. So we put them under Board of Health orders for a variety of things, one of which was to figure out what's wrong with their system or to make sure they can supply adequate water. And they have done that part of it. They did some changes to their well to improve the yield and submitted an engineering report. So that's been a good success. they have not taken the samples, or at least have not submitted the bacteriological samples that they are required to take after a boil water order in order to release it. And, you know, this is despite our ongoing efforts to communicate with them. So that was that, and failure to submit other things were part of the original resolutions. What this resolution is doing is essentially is acknowledging their progress with the engineering report and other things, and reducing their fine to $1,000 as long as they comply with other requirements, such as submitting their missing monthly operating reports and doing the samples so we can release their boil water order. And then there are other ongoing requirements in the Board of Health order. But we would like, what this resolution is proposing is that they pay a penalty of $1,000 as long as they meet those other conditions to do the samples and submit the monthly operating reports. And also give us a contact. I think that's one of the requirements, because we've been unable to effectively communicate with them. So that's kind of the brief summary. Adriel Shea, who manages the water program, we made an effort to contact Tony Bussey, the owner, yesterday, and ended up being successful. And of course, he appeared unaware of the order and did appear interested at the potential for a penalty reduction. So we're hoping we have his attention in a positive way by doing this, and that there will be follow-up.
Great, thanks.
He has to follow up in the next week. Is that right? Otherwise, things go back to $3,000. Yeah. And okay.
We will follow up with him after, or try to reach out to him after this, both verbally and in writing, to try to make sure and that he is aware of the requirements.
Any other questions? Okay, all in favor as written? Okay. She's gonna get an accent. All opposed? Abstentions? Okay, great. Okay, two last things. I just want to make sure board members looked in the last page of their board packet, because it has the list of board meeting dates for 2021, and that you have those on your calendar and blocked. So that would be great. And then before we adjourn, I just wanted to turn it back over to Frank for one more thing.
Thanks, Christina. I actually have two things. First, Dr. Evelyn has accepted the nomination. He's good to go. And then also I wanted to recognize another retirement. Shelley Kimizzi is going to be retiring at the end of the month from the department. And Shelley has been with the department and with the county for many years. And she served as the secretary for the Board of Health for quite a few years as well. And quite frankly, I don't know how I would have gotten through the last few years without her. I would imagine my direct reports would say the same thing. She's been the linchpin, kind of holding it all together from a scheduling perspective for me. And she's certainly going to be missed, but I wanted to wish her well in her retirement as she does move on, and thank her for her many years of service to both the department and the board.
Shelley, we hope you're doing something fun. And if you need a partner in crime, Jan isn't going to have anything to do here in a few weeks. So can do something fun together. Thanks, Shelley, for everything you did.
Actually, Jan was on the board when I started covering it. I started in 2011 at the end of the year. So we're kind of going out together, I guess.
Yeah.
It's been great working with everyone. You've all been so helpful and supportive, and so you made my job really easy. And I wish everyone well as you continue on doing your good work. Thank you.
Shelley, congratulations.
Thanks.
So Frank, will there be somebody moving into Shelley's position, or we don't know?
Yeah, so Karen will be doing the secretary role
Right.
for the board. There's the list for Shelley's position expires next week, and
Okay.
I'm not going to be able to get it filled in time.
Okay.
So I'm going to be waiting for an exam to be offered at the beginning of next year, and then once that list is formed, we'll hire from there. So
Okay.
Liz and others are going to have to struggle trying to track me down for a couple of months.
You have your cell phone number.
Unfortunately, everyone has my cell phone number.
Okay.
Just interject here, Frank, just to say to Melissa that it works for us to stay on Zoom with you, Melissa, at this time, if it's good for you.
Okay. I'm gonna let the rest of the board go and adjourn, and so that the three of you can go ahead and talk. And just remember, you are recording, Frank. So before you, okay, start your conversation.